Comprehensive, relevant, and insightful conversations about health and medicine happen here on MedStar Health DocTalk. Real conversations with physician experts from around the largest healthcare system in the Maryland, D.C. region. Welcome to MedStar Health DocTalk. I'm Ryan Miller, and I'll be your host for today's episode. I'm joined by Dr. Elizabeth Barrows, a medical oncologist specializing in breast cancer. She cares for patients with all types of breast cancer, including hormone receptor positive, HER2 positive, and triple negative breast cancer. Dr. Barrows treats patients throughout their cancer journeys, providing chemotherapy, targeted therapies, immunotherapies, and precision medicine. Thank you so much for joining us today on MedStar Health DocTalk.
Thank you so much for having me.
You specialize in a number of types of breast cancer. How do you figure out and determine what type of breast cancer someone has?
Yeah, so this all starts off with a screening mammogram. So the first thing that we do is we identify if there's an abnormality. Once we find that out, we have to do a biopsy. So that requires using a needle to go get a little piece of that suspicious area from within the breast. Once we have that, we send that off to our pathologist to look at it under a microscope. So they will run various tests on it, and they will basically help us to determine which of the three types of breast cancer a patient can have.
What's the turnaround on getting that answer? I know it could depend on workload and things like that, but is there an average?
Yeah, I think our imagers are actually pretty fast at getting people in. So, the turnaround there probably won't be very long. The pathologist usually will take about 2 weeks to go through everything, process the specimen, and then finally come out with the final pathology.
Interesting. And between hormone receptor positive, HER2 positive, and triple negative breast cancer, which is the most common?
Hormone receptor positive is the most common. About 65 to 80% of breast cancers are hormone receptor positive. The second most common is HER2 positive, and the most rare is triple negative.
Would you say all three are treatable if caught early enough?
Absolutely. Our goal for treating these patients in the early stage setting is absolutely the goal is cure.
You have a great team of doctors and nurses and staff that you work with. Why is it important to use a multidisciplinary approach for developing someone's treatment plan?
Treating breast cancer, especially in the curative setting, does require a team of doctors. So we have surgeons, we have radiation oncologists, and we have medical oncologists such as myself. So all of us work together to find the appropriate plan of care for each individual patient, whether that should be surgery first or some kind of medical therapy first. When does radiation come in? All those things we need to sort of figure out together.
I imagine someone's plan can change depending on the type of breast cancer.
Yes, absolutely. So there's definitely different approaches for the order of therapies depending on which type of cancer somebody has. So we all discuss every single new patient and their diagnosis at our weekly tumor board. So we come up with an individual plan of care for each patient depending on their type of tumor.
Have you ever seen a patient that has one type of breast cancer and then beats it and then unfortunately gets a different type of breast cancer?
Yes, we have seen that. That is rare. Usually if it does come back, it will probably be the same kind, but yes, it does happen.
So once you've developed the treatment plan, when does that start? Within weeks of laying that out?
Yeah, so once we, all meet together, we will, depending on whatever is the first step, we kind of get things going as soon as possible. Most of the time, a lot of these patients will do surgery first, so our surgeons will work on getting them posted as soon as possible. In the meantime, they'll try and meet with us, the medical oncologist and the radiation oncologist, if we are able to get them in, which we usually are, just so that they have a full idea of their treatment plan before they go in for surgery.
And can someone still work during their treatment? Do people often have to take time off work?
It really depends. If patients don't need chemotherapy, most of them can probably go back to work in some degree. Even during chemotherapy, I have had patients try and work through it or work through part of it. It really is very individual, but obviously, whatever is right for the patient, we're here to kind of support them through that.
Once you have the plan in place, is there anything that the patient can do on their end to help prepare for it?
Really just, ask any and all questions. Like there's really no such thing as a stupid question. We love to make sure that patients are fully educated and aware of all their options and that they're comfortable in their plan of care.
I love that. Yeah, don't be afraid to ask any questions. What kind of support services are available to patients?
Yeah, so we do have a variety of support services. I think we really have a great social work support team. They can offer all sorts of things from, getting patients across to, patient support groups and things like that. We also have really good transportation services that can get patients to and from appointments. We have really good nutrition services for patients that want to meet with a dietitian. And we have a really strong physical therapy program at MedStar, so we can refer patients to our physical therapy program. We also have something called the STAR program, which is support for patients that want to quit smoking. So we have a lot of things that we can help patients with.
And now, is there any correlation between smoking and breast cancer?
Absolutely, yeah. So smoking can increase your risk of any kind of cancer, including breast cancer. And one of the best things that you can do to prevent your risk of developing a breast cancer at all or having your breast cancer come back is to stop smoking. So that's why I think this program is really beneficial.
You're often seeing these patients at one of the most difficult times in their lives. How do you and your team try to help put someone at ease?
Yeah, I think, like I said, the biggest thing is just making sure that patients feel comfortable with the care that they're receiving with us. I think we have a really empathetic team of doctors and we have really great nurses as well. All of our staff really, we try to do our best to make sure that things are as easy for patients as possible.
What advances in treatment are you most excited to offer patients?
Yeah, so we have many new advances in breast cancer. We really have new treatments that are coming out every day, and we have really a wide variety of clinical trials here at MedStar that really can offer patients cutting-edge therapy before it's even approved. I think one of the things that I'm most excited about is we have a lot of new drugs in the advanced and metastatic setting, so the stage 4 setting, that we're now working on bringing to the curative setting. And this is really exciting because a lot of these drugs are, we think really effective, and being able to use them in the early stage setting to potentially cure someone could mean that there are less patients that are then becoming metastatic or stage 4 in the future.
Wow. And then you said some to address people that are as far as stage 4?
We have clinical trials for patients in the curative setting and in the advanced setting as well. But, a lot of the newer drugs are usually being tested in the stage 4 setting. And once they're proven in that setting, then we tend to move them to the earlier stage setting.
Dr. Barrows, what kind of research are you currently involved in, and why do you encourage patients to enroll in clinical trials?
My area of research is in advanced hormone-positive, HER2-negative, and advanced triple-negative breast cancer. So this is patients that have metastatic or stage 4 disease, usually patients that have already progressed on some of the more well-established therapies. So I'm really looking at new combinations of drugs that can not only improve outcomes, but also improve quality of life. That's something that's very important to me. As patients get more treatment, they can tend to get more burned out, which makes sense. So, finding treatments that fit in with a patient's life rather than a patient trying to fit in treatment into their life, that's something that's very important to me.
What led you into breast oncology?
I was always interested in women's health. I actually went to med school to be an OBGYN, but I quickly learned I was not a surgeon. So I ended up in my journey through internal medicine, and I really found my calling in oncology. It really means a lot to me to be a part of somebody's life during such a vulnerable time and being able to guide them through, such a terrible time in their life and help them to, see the light at the end of the tunnel. That's very meaningful to me.
What role does someone's family history play in the potential for them to develop breast cancer?
Yeah, that's a great question. So we're learning that there is a strong genetic component to many cancers, but breast cancer especially. And, when patients do develop breast cancer, a lot of times we will refer them for genetic testing. We do intake of their family history to make sure that we're not missing anything. And a lot of times we will refer patients for additional genetic testing, which can also potentially open up new avenues for additional treatment for them in the future.
My mother is actually a 2-time breast cancer survivor, so happy to say that. But do you think that means I also have young daughters, but someday they should get tested for BRCA?
Well, it's more than just BRCA these days. We have many, many genes that we look into. Usually most of the breast cancer genetic testing will look at up to 42 or sometimes even 78 genes. So, yeah, absolutely. I think, my grandmother also had breast cancer at a young age. So, I think having genetic testing is a really good choice.
Seems like just about all of us know somebody who's had to go through it. Are you seeing more men that get breast cancer, or, as someone like me who has a family history, do you encourage myself to get checked for that?
Well, a lot of these hereditary cancer syndromes are not just breast cancer. They can actually involve breast and prostate cancer or breast and colon cancer and other types of cancers as well. So it's always good to, if you have a strong family history of cancer at all, it's always good to have genetic testing. Regarding men with breast cancer, it's obviously much less common, but it still definitely happens. And I think that making sure that there's awareness that men can get breast cancer is also very important. I have treated men with breast cancer both in the early stage setting and also in the metastatic setting. So it is absolutely possible. We should definitely work to make sure that men know to get themselves checked.
Can you speak to the importance of women getting screened? And can you remind us of the latest guidelines on when they should do that?
Yeah, so screening mammograms really save lives. I mean, the most important thing is that we catch them early with screening mammograms. When they're caught early, they are curable. And I've had many patients that have had something caught in a screening mammogram, 20, 30, 40 plus years ago and are now still cancer-free. So it's really important to get screened and get that detected early. For the general population, you want to start screening at age 40, and you can get screened every 1 to 2 years. My preference would probably be to lean on the side of 1 year, but that's something that they can discuss with their primary care or with their OBGYN. But if you have a strong family history, then I do think that it's worth it to try and start getting screened earlier, or at least meet with a genetic specialist that can help guide when is the appropriate time to start screening.
Because it was just a few years ago, 45 was the number.
Exactly, yeah. Same with colon cancer. It used to be 50, now it's 45, which is great.
Is there a correlation between those two?
Not necessarily, but there is obviously, everyone is hearing about it now, a trend for younger people to be developing cancer earlier, which I think is what's prompting all this.
Dr. Barrows, can you walk us through your philosophy of care?
For me personally, the way that I approach it is that, my job is to educate. So really, I want to make sure that whatever decision my patient ends up making regarding their plan of care, they have all the information and that they fully understand all the options that are available to them. It can really be overwhelming because there's so many different treatments, and especially in breast cancer, treatments can last for years. So I really want to make sure that my patients are fully educated and that they feel empowered to choose the right treatment that makes sense for them.
And at what point do they need to stop Googling their symptoms and come see a doctor like yourself?
Well, I am also a professional Googler, so I really know that I have no right to say anything. But yeah, I mean, I encourage patients to let me know what they've been Googling and what they've been hearing, because I'm happy to kind of get into that with them. I don't want them to feel like they can't share additional treatment options that they've heard of or anything like that with me.
Well, that's a great approach to have for sure. Just one more and we'll get you out of here. Thank you so much for your time. Why should patients choose MedStar Health for their breast cancer care?
So we've been providing state-of-the-art breast cancer care for over 30 years, and I really think that one of the strengths of the program is that we prioritize an interdisciplinary care approach to treat the whole person and not just the cancer. And obviously, as I said before, we have phenomenal doctors, nurses, we have really great social support, and the other thing too, as I touched upon earlier, we really do have an impressive clinical trial portfolio that I think all patients can benefit from.
Great answer. I've been talking with Dr. Elizabeth Barrows at MedStar Washington Hospital Center in Washington, D.C. Thank you for sharing your expertise with us today on MedStar Health DocTalk.
Thank you so much. It's been a pleasure.